I'm now so excited to introduce Pascale Leone. She serves as CSH's Director of Diversity, Equity, and Inclusion, where she brings more than 15 years of experience in developing, implementing, and evaluating housing and public health initiatives aimed at reducing and preventing racial, ethnic, and gender-based health inequities. In this role, she provides strategic direction and thought leadership to advancing the organization's anti-racist framework, fosters a diverse and inclusive work environment, and ensures accountability and commitment to equitable outcomes across the organization's diverse portfolio. Prior to joining CSH, she held appointments at the American Lung Association, Black Women's Health Imperative, and Planned Parenthood Federation of America. Pascale received her Bachelor of Arts at the University of Albany at SUNY, majoring in Africana Studies and Political Science, and her Master's in Public Policy at the Rockefeller College of Public Affairs and Policy in New York State. She is also a longtime friend of the Health and Housing Consortium and a newly joined board member. We are very lucky to have her. Pascale, welcome.
Thank you so much, Bonnie and Amy. Can folks hear me okay? Okay, great. Well, first, I just want to also echo the sentiment. Just such an insightful and informative 2 days. And I think it's really reflective of the tremendous and innovative work that has taken place in probably the most, one of the most difficult years in modern history. And so, you know, as folks are in the chat, definitely you want to echo the sentiment and give more love to the presenters, to the panelists, to the organizers, to Bonnie and Amy for the 10th annual Bronx Health and Housing Consortium. So definitely give them love in the chat for such a timely and rich set of discussions. And so as folks are getting their just flowers, I just want to say it's truly an honor to join today as a longstanding friend and supporter and partner and now a board member for the consortium. I was just thinking about, you know, last night just how, in fact, Penny and Bonnie were some of the first people I met when I started working at CSH some 7+ years ago, and that, you know, their leadership has really been transformative as evidenced by these 2 days and just the legacy of their work to date. And so thank you, Bonnie, for your leadership, and thank you so much, Henny. You know, as Bonnie mentioned, I'm the Director of Diversity, Equity, and Inclusion at CSH, really helping to soldier our journey to build an anti-racist and race equity culture, one that really forces us to identify and challenge and eliminate racism wherever we find it, even if it's within ourselves. And you know, it's that recognition that we need to fundamentally change the systems and the institutions that cause racialized inequities and not the people, right? And so these last couple of days really underscored the need for this reimagining of how our historically siloed sectors and institutions operate to serve the most vulnerable. And I think it was Jocelyn Groden from DIFTA who highlighted that, you know, we've seen, you know, this cross-agency collaborations that in this virtual space that didn't exist a year ago, right? And so the question now is, how do we capitalize on this, right? You know, it goes without saying that 2020 was a year like no other, really, you know, exposing the deep fault lines of our social safety nets and unmasking the clear intersections of health and housing and racial and economic injustices. And so, you know, I was just so pleased to see and hear the intentional thread that was woven in each of the sessions to really center racial equity in this work. I have to say it's, you know, a privilege to bookend the convening following Peggy Bailey, who was my former colleague, a friend and mentor who started us in talking about affordable housing as an entitlement, right? And not a privilege, and how housing is a social determinant of health. And I think many will argue that housing is the social determinant of health, right? We've long known that your zip code is more important than your genetic code, and where you live is a good predictor for how long you live, right? What I really appreciated about Peggy's talk and opening was the truth-telling. You know, she reminded us that a critical misstep that we've been doing in the housing and healthcare world for too long is trying to align goals when we should be trying to align solutions, right? We know the antidote, but somehow we've, over the years, fallen more in love with the problem for far too long, and we need to divorce ourselves from the problem and start falling in love with the solutions, right? And we know that the solution is affordable, accessible, and quality housing with the supports people need to thrive. Some more truth-telling that Peggy provided us was the ability to name all the things, right? The advent of COVID and the ensuing racial and economic reckoning really allowed us to name the unnamed, right? The devastating, destructive role of structural racism, and that the overrepresentation of Black, Brown, Indigenous people in homelessness and the justice sector, poor health outcomes, they're not happenstance. They're systemic, right? And we have to be very clear in naming that race is not an indicator of adverse health outcomes or housing instability or homelessness. Racism is. And so race is just a social construct, right, with really no bearing in biology. And so we have to tell the truth about the root causes of the racialized inequities that we see. You know, I was so moved by the incredible work of the Wellness Empowerment for Brooklyn Participatory Action Research, which is such a great example of co-creation research and really getting proximate, right? And in grounding our solutions in the experiences and the voices and the perspectives of those who are most impacted by the problem. I was overwhelmed also to just feel this sense of joy and optimism and just looking at the brilliance of our young leaders, right? And knowing that we're in good hands. And so that was just something that was just balm for the soul for me yesterday. You know, this morning, the panel, a shout out to Patricia, Juan, Casey, Shane, and Dr. Land, who really showed us the promise of meaningful integration of homeless outreach within our health systems and what it means to really foster meaningful collaborations. But, you know, the real challenge here is sustaining this great work, right? You know, Dr. Land said it clearly, we know the solution, it's solvable. It's a solvable problem. And I saw the comments in the chat were making it clear that there's really no single path to the solution, right? But what was apparent is that we're still doing this ongoing tinkering around the edges and trying to pilot our way to sustainability, which is impossible, right? We need long-standing commitment to bring these cross-sector interventions to scale, right? We can't pilot our way out of this. The last two panels, the panel around the caring for older adults, you know, we know that COVID has had a devastatingly disproportionate impact on our older New Yorkers. You know, it's clear that COVID was no great equalizer, right? And so we know this by now. But I think Tanisha had mentioned that 75% of all COVID-19 deaths are among people 65 and older in New York. And so I want to pause for a moment and just to feel the gravity of that sobering stat, right? And the considerable loss of our elders this past year, right? As my colleague Courtney described, our culture keepers, our keepers of community that were lost over this past year. And so, you know, COVID really required us to do that significant pivot to a virtual world, right, that exposed and actually widened the digital divide that we knew existed for our aging seniors. But it also created opportunities for greater connection for some who previously weren't, you know, engaged in services in senior centers, right? But we also have to contend with a huge challenge in terms of the emotional toll on staff and their enormous loss and mourning and trauma that folks are dealing and holding, right? We need to honestly and comprehensively address the needs of our frontline workers. And I think Kelly Doran had put in the chat, we have to give our flowers and all the shout outs to the frontline and essential workers and street outreach and all our heroes through this work. You know, I really love the conversation about the conversion of hotels to permanent housing, right? I think that'll be the biggest loss from this is that, you know, turning folks back onto street and shelter, right? And how do we get permanent solutions? I want to thank EJ for sharing your experience with us and really grounding us. You know, we're so glad that you're well and you're here with us today. And also to Kandra and Simone for your truth telling. I really appreciate it. And so I'm going to wrap up because I know folks have things to do, but, you know, I just want to share that it's my hope, right, that the lessons and the stories and the vision that was imparted on folks today, you know, serve to inspire you and not let this moment of innovation be a fleeting one, but really a movement for bold transformative change. And so shout out to Harmony because I really just sent this to her. And so thank you for pulling this up. But early into the pandemic, when we had no idea, well, we had an idea, right, what was going on, but just how impacted this country was. And we kind of saw the writing on the wall, right? But I was so moved by the piece by novelist Arundhati Roy, The Pandemic is a Portal. And so in it, she says, whatever it is, the coronavirus has made the mighty kneel and brought the world to a halt like nothing else. Our minds are still racing back and forth, longing for a return to normality, trying to stitch our future to our past and refusing to acknowledge the rupture. But the rupture exists, And in the midst of this terrible despair, it offers us a chance to rethink the doomsday machine we built for ourselves. Nothing could be worse than a return to normality. Historically, pandemics have forced humans to break with the past and imagine the world anew. This one's no different. It's a portal. It is a gateway between one world and the next. We could choose to walk through it, dragging the carcasses of our prejudice, of our hatred, our avarice, our data banks of dead ideas behind us, or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. Friends, we're at a critical inflection point, and we should not yearn to return to normality, right? Normality was deadly. Normality was killing Black, Brown, Native, elderly, disabled, and others who are holding marginalized identities. Now we have this opportunity to boldly reimagine how we face the challenges ahead of us. And so I want to ask you, what is the new world that you want to imagine? And are you ready to fight for it? And so I want to thank you all. It's been my complete honor and pleasure to be with you today. And thank you so much. And thank you for being in community with us all. Thank you.